don't you like about being an NP? Ooh boy, this was, at first I was a little hesitant to answer this one, but I mean, but this ended up being a very easy question to answer. Another question from the tribe, probably, if I'm not mistaken, this was from a nurse interested in learning more about the NP role and learning about the things that nobody likes to talk about. Those kind of things that are bad about being a nurse practitioner. And sorry to say, I don't have a lot of those answers. I got 3 things that come to mind when I think about what I don't like about being an NP. And these are general observations. They are not specific concerns, actions, interventions, or instances. These are generalized observations. Number 1, identity crisis. NPs have an identity crisis. We have to live down the middle of the road, meaning we're definitely not a doctor. We don't have the education, training, skill level of a physician, yet we fulfill many of those duties of the physician, and in many settings we can function as close to a physician as it gets. Prescription authority, independent practice in some states. So we kind of do what physicians, so on the one hand we kind of do what physicians do, but we're not physicians. Let's make that clear. Let's not go down that road. We are not physicians, but we come pretty darn close to doing what they do. And on the other hand, we're not nurses anymore. We're advanced practice nurses. Of course, we all have to be registered nurses prior to being licensed as an NP. In some states, the NP signifier is the CRNP, which is Certified Registered Nurse Practitioner. In my particular state, that's what we use. So you gotta be a registered nurse before you become a nurse practitioner. But we're no longer, we have advanced our role, we have advanced our skill, we have advanced our education. So we're no longer, you know, and the scenario I can only give is that I'm no longer the bedside nurse. I don't perform bedside care, even though as an NP I work at the bedside. So I'm no longer a nurse, but I'm not a physician. So I have to live down the middle of the road, and you know, I'm a man with no country. So we have this identity crisis. So you could sort of hang out with the nurses you work with, but you know, you delegate to them. So you are their leader, as in leadership. So you kind of fit in, but you don't fit in. You could hang out with your physician colleagues, but you didn't go through medical school or fellowship or residency or anything like that. So while you work side by side with them and you kind of do their job, you're really not them. So you don't go, you can't completely commit to that side either. So you kind of just hanging out in the middle of the road on that one. You get to do a little bit of both. So you can look at that both ways. You can look at that as the best of both worlds because you get to hang out in both worlds, or you can look at it as you have no home. Number 2, lack of understanding and lack of respect. This kind of clumped together. Lack of understanding and respect. And this has to do with anybody that comes across a nurse practitioner. This can be nurses, this can be physicians, this can be other healthcare professionals, other ancillary staff, this can be the public, this can be individuals that have absolutely no medical training or experience, or it can be complete strangers, it can be patients, it can be family members, anybody. There is a generalized lack of understanding and respect for the role of a nurse practitioner. And the way I view it is that most people don't understand what we do until you need us. It kind of plays hand in hand with what most people don't understand what a nurse does until they need them. And it kind of, you know, I'm going to use the same analogy because, well, it's my answer. So most people have a sort of an idea of what NPs do, but not really. We're not a physician, but we're not a nurse, so you're in the middle, or are you in the middle at all? There are some people that thought that I've actually come across individuals that they thought an NP was less trained, less educated, they on the echelon of, you know, direction, that they took direction from an LPN. So they were in between a CNA and an LPN. So they thought that NPs had no collegiate education. So that just kind of speaks to the misinformation that the public has. And it's partly our fault because of the alphabet soup that we have created amongst our society. You have NA, CNA, LPN, RN, CRNA, CRNP, ARNP, AGACNP, ACNP. You get the point. Acronym overload. On one hand, understand it and can appreciate it, but on the other hand, it gets a little tiresome having to defend my education, my training, and my practice. And this is to anyone that is unfamiliar with the NP role. This includes current practicing physicians. Which leads me into number 3, the old school mentality and not allowing us to practice to our full capabilities, to not let us practice to the fullest extent of our scope of practice within the state guidelines that you reside and practice in. There are a lot of old school, okay, let's just say it, docs. There are a lot of old school docs that feel that nurse practitioners, their place, their role is to be the paper pusher. They basically do the physical assessments, they do the H&Ps, they do the intake forms, they do the mundane, rudimentary, annual things that doctors don't have enough time for, and they don't allow nurse practitioners to practice to the full extent of their capabilities. They become gophers and paper pushers. They become order entry slaves. And if anybody has ever experienced working with old school docs, they also treat the bedside nurses the same way. And it's very frustrating, and you know, I hate to say it, you're not going to teach an old dog new tricks, not until they are willing and wanting. Thankfully, I work in an environment that utilizes NPs to their fullest extent, allows us to practice to our fullest extent, and are very familiar with our knowledge base and what our capabilities are. And it's kind of the ideal situation. So I'm a very lucky individual, a very lucky nurse practitioner to work in the environment I work in. So these 3 things that I've spoken of speak to all the things that, I mean, all nurse practitioners would agree on that we have challenges with. As a bonus answer to the question of what do I hate about being an NP, it has everything to do with all the other stuff that are shared with the nurse, with the bedside nurse, with the registered nurses. All of the life-sucking moments that you have. Like, for instance, it really used to just stab me in the heart when I would talk with families and give them my spiel, and they would either wait until I was done with my 30-minute conversation and then say, okay, now can we talk to the doctor? Or they have a, the nurse tells you that, hey, the family has a question about what's going on with this, blah, 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 blah. Can you come in and talk with the family? And you go in, you recognize their needs and say, so I understand you have some questions about blah, 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 blah. My name is Sean. I'm one of the nurse practitioners, part of the critical care team to help them take care of so-and-so. And their immediate response is, oh, well, we would like to talk to the doctor. That used to really set me off, but now it kind of like, now I really don't care. Every so often I'll have a bad day and someone will, it'll be just at an inopportune moment and it will get under my skin and it'll elevate my blood pressure and, I really want to just throat punch somebody. But to me, that's just misinformation. They don't fully understand our capabilities. It's constant, vigilant education, being aggressive, being proactive about educating everyone that has any interaction with the NP role. Of course, we all hate the a-hole doctors and the idiot healthcare professionals that treat you like you don't know what you're talking about, and you absolutely can't stand the family members that just drive you up a wall. But these are all things that all healthcare professionals have to deal with. So I figured I'd stick with what I don't like about being an NP.